So I started having some symptoms with my GI, and it's on my left side, in my intestine and sometimes left stomach as well. The symptoms that I've had was the feeling of pressure and also bloating, especially after I eat a meal, whether it's small or big. And the bloating would be quite intense because after I eat a small meal, the bloating would actually make me feel like I've had a big meal. Now, during this experience, I lost like 20 pounds over the course of about a year, because it was just hard for me to eat and not have these symptoms. When I had a bad episode of this symptom, it was it felt like I had cramps, and also some bloating. During a bad episode, I did go into to urgent care, and they did a CT scan on me, and the only thing they found was that maybe I had some fatty tissues around my GI, and they said that usually that'll just resolve by itself over time. And so I thought that would have been the case, and so I started exercising the next few months to cut down on my weight, but the GI problems still kept going, and it seemed to actually have gone a bit worse. And like I would feel this pressure more and more on my left side, and it got to the point where it was hard for me to sit down and not feel high discomfort. So sometimes when I'm working on my computer, I would actually be standing up because that way I don't feel that pressure and discomfort. And so months later, I think it was about the 1 year mark, I went back into the doctors because I asked if it could be H. pylori, which is this bacteria that lives in the stomach. And I did an H. pylori test, and it came back positive. So I thought to myself, maybe this is it. It's H. pylori. So I took antibiotics for 2 weeks. And after the antibiotics course, I did feel better for about 3 to 4 weeks. I thought, wow, okay, everything's gone, and I'm gonna be feeling normal again. But after I think about the 4th week, I had a bad episode again where my GI just felt really bloated, and also I had cramping at the same time. So I went back to the ER, and they did some checkups on me, and they think it's gastritis, and they didn't really have any answers for me because there's not really too much treatments for the GI at the Western doctor. And after having that experience, I went through the antibiotics. I didn't know what to do anymore. I did some research online, and I found that acupuncture could be a way to maybe help with my condition. And so I did do my acupuncture sessions, and within the first 2 weeks I started feeling better. And Dr. Fu, he advised me on what not to eat as well, and I think that also helped. And by the third and fourth week, I would say most of my symptoms disappeared. And I continued my treatment for about 2 months, and I felt good since, and I haven't had any problems with my GI anymore. And I'm very thankful that I was able to find relief with my symptoms.